Oral hygiene and the fresh breath associated with it are part of healthy daily habits. Over time, poor dental care will cause mouth odor. The foods we eat contribute to bad breath too. However, bad breath may be a symptom of a health condition or a side effect of medication. Most people aren't aware of the fact that over 50% of the bacteria found in the human mouth contribute to bad breath. Every year, on August 6th, the world celebrates Fresh Breath Day. This day is observed to educate and make people aware of these and other factors related to having fresh breath. This day is observed to educate and make people aware of these and other factors relating to having fresh breath. We at Medicircle are conducting a series on National Fresh Breath Day Awareness Month series to create awareness regarding oral hygiene and oral care amongst the general public. Hello, I am a Pranjan Mitra, and today our guest for the talk is Dr. Pranjan Mitra. Dr. Pranjan Mitra is co-founder and chief medical officer of Denta Mitra, an awarded and reputed dentist and a professor in dental college and hospital. He has more than 50 international and national scientific research papers to his credit. He has been in the field of dentistry since 8+ years and is a guide to aspiring dental graduates and postgraduate students. He was recipient of the Indian Health Professional Awards in 2017 for the category Excellence in Public Health Dentistry and was also nominated for the Rural Dental Service Award. Dear listeners, these credentials have surely piqued your interest in what Dr. Speak brought for us today. So do like, share, and subscribe our channel. And please continue listening to us. Welcome to Medicircle, Dr. Pranjan Mitra.
Yeah, thank you so much, Aprajita, for the wonderful introduction. And thank you, Medicircle, for giving us me an opportunity to present regarding very important topic about bad breath. I'm sure you have taken a very to the point oral health problem which everybody, common man, faces. Yes.
Absolutely, sir. Thank you so much. I'll start with the first question, which is a very simple one. How often should one brush for better breath?
I think this is a question for every household. Like most of the people, they have a question, how many times you should brush. So actually, there is a two rule is that you should brush twice a day with a fluoridated toothpaste. I think many people have a question like we brush 2 or 3 times, sir, but still our teeth is not getting clean. So they should brush properly, and 2 times. That is also time is very important. Some people they brush not at the appropriate time. So you should brush early in the morning before you have your breakfast. Some people they have a confusion that after breakfast we should brush. Munch on something, then we'll brush. No. So as soon as you get up in the morning, you should brush. Then after food, just before you sleeping, you have your dinner, then brush, and with a fluoridated toothpaste. Okay, no, the other toothpaste should not be used.
Sir, my next question would be, does taking help of mints and chewing gum, do they cause harm in the long run?
Yes, so like chewing gums, you should be avoided at a very, you should not use chewing gums for a very long time period. Like we people have a habit that after usually the Indian, they have having something sweet after food. Like we are in a wedding, we go to we can have a pan or like soft like that. Okay, so there is like we have a habit of having something sweet after any meal, so that should be avoided. Like we have some sugar candies and that. But even if many people have a tendency to have munch on something after having food, so this sugar means they should be avoided. If at all you have a habit, there are sugar-free chewing gums are available in the market. That can be used. And I would prefer patients not to have anything sugary after food. If they are having that kind of like urge to have it, you can have soft, that is normal soft is there. Okay, then we can have ajwain, and in the Indian context, it is very we can ajwain that is very healthy for digestion also. So I prefer my patient not to have any chewing gums or mints because they will add added sugar in the content.
More or less, you have directed me to the next questions that what I was about to ask was how to avoid having bad breath. There's certain people I've seen, despite doing, as you said, brushing and everything, they still have the constant problem of having bad breath.
Yes, the bad breath problem is very common. Even in the morning, sometimes you may feel like in the morning I get some bad smell in my mouth. That is natural because what happens after food, the bacteria gets the whole night time to fight because no saliva, we are not talking. No, so it's a very happy environment for the bacteria. So as it works on our food, deposits in our tooth, and it creates a bad environment. So that is the smell which we get in the morning. So for that, we need to brush early in the morning, clear? And also that is what regular brushing is required, 2 times brushing, as I said. And also visit to a dentist. Regular 3 months visit to a dentist is extremely important because you will not know whether you are having deposits. Proper dental care has to be taken. And also rinsing is very important. Like people often think that we have brushed twice a day, it is fine. But no, we can't carry the toothbrush every time with us. Yeah. So we need to rinse our mouth. The main problem with the patients and the people who are having that everybody should follow that even if you eat a piece of biscuit also, you should go and swish your mouth. That will definitely improve your oral hygiene. That is the main motto, crux of the problem.
You've also answered, you tried to put into ideas into my brain about home remedies, like you mentioned soap and ajwain already. So what are other home remedies for the fresh breathing?
Yeah, fresh breath. Very common if we follow, they tell no, like garam pani mein kulla kar lo, namak dal ke. Okay, that is very salt. It is very common in one household. So that can be followed. And also if you have some bread, you should, instead of using the sugar mints, you can have a clove, long you can put in your mouth. That will freshen, and that has an very astringent effect also. And also you can keep some onion and garlics in your mouth also to avoid the bad breath. Okay, that can also be done. And also like you can use apple cider vinegar also, a syrup. Okay, that I have a ready-made recipe for your mouthwash. Okay, homemade mouthwash. If you'd like to hear also. So you can take you can take a cup of water, warm water in that. You can put cinnamon, half teaspoon of cinnamon in it. Then you can put honey in that. Okay. Then you can put a baking powder in that, right? And keep it and mixture. Keep the mixture for some period of time. So, and use it as a mouthwash also. So that remedy can be done also.
Wow, that's an excellent idea. I'm sure all our listeners are going to really, get help from this. So thank you so much for coming to our show and sharing your valuable time, insights with us at Medicircle. It has really been a pleasure having you on the show. Thank you so much, Doctor.
Yeah, thank you so much, Aparajita. Thank you, Medicircle.